Hi friends, this is Dr. Abdequaem Chimthanawala. Today let me discuss one of the rubrics, again very commonly taken in our daily practice. If you had seen my previous video, that company aversion to Tukayu. Now today we'll take company desires for, a purely soric rubric. Now that means I desire company. I'm very happy when I'm in company. I like to talk to people. I am if I am feeling dull and low, I like people. I like talking to people. So there are a lot of variations and permutation combinations in a simple meaning. Company desires for. But in our metronomy, in our repertory, there are different ways and different colors to this. A simple rubric, for example, if a patient company desires for, that a very close rubric that comes to your mind first is anxiety alone when a person basically has a lot of anxiety when he's alone, hence he wants company. He likes to be in company because he feels better, the anxiety goes down. So this is how you have to take the rubrics, that is anxiety when alone. Or the patient may say he's very cheerful when he's in a company. He has a lot of friends, and when he's in friends, he's very cheerful. He talks. It feels as if nothing has happened. If something wrong has happened to him, so cheerfulness in company also a very close and very important rubric in this context. Thirdly, fear of being alone. A person says, sir, I cannot stay alone. मैं अकेला नहीं रह सकता. मेरे को कोई ना कोई हमेशा साथ में चाहिए. कोई ना कोई तो चाहिए, चाहे छोटा हो चाहे बड़ा हो, चाहे कोई भी हो, चाहे फ्रेंड हो चाहे फैमिली हो, बट कोई ना कोई तो मुझे चाहिए. मैं अकेला नहीं रह सकता. मुझे हमेशा कंपनी चाहिए. मुझे कंपनी बहुत पसंद है. That means he is a personality where he has fear of being alone, so he always wants company. See, how do you get this rubric from the patients? Or fear of solitude. इफ अ पर्सन हैज फियर ऑफ सॉलिट्यूड, उसको अकेलेपन से डर लगता है, वो अकेले में कुछ तो भी उसको थॉट्स आते हैं, वो एंशियस हो जाता है अकेलेपन में. दैट टोल्ड यू द फर्स्ट रुब्रिक. So that also a personality basically always desires company. So the rubric is fear of solitude. Next, inconsolable. Inconsolable. The patient, something has gone wrong. He's inconsolable. So always wants company or desires company. For example, weeping when alone. A person basically a timid personality, if you say, but weeps when he's alone. When he's in company, he is very happy, he is cheerful, and that's why weeping when alone also becomes a very close rubric for company desires for. One more symptom, one more line I told you when I started the video. Some persons like to talk to someone. So if a person likes to talk to someone, definitely he will want somebody with him. So always desires company. And a beautiful rubric there is in our repeat, that is talks desires to someone. See how just one language, just what the patient tells and how the rubric changes. That's why you have to have a lot of rubrics in your mind before selecting this. A very close knitted. That's why it always says that homeopathy is an art. To prescribe is an art. Next, some patients are very irritable. Some patients are very irritable when they are alone. They always, for example, phosphorus. For example, a lot of remedies are irritable when alone. So when they are with somebody, they are very happy. Hence, they always desire company. So company desires for. And exactly opposite, indifference, company amelioration. An indifferent personality. He does not want to talk to anybody. He's very snappish. He is very irritable. He is very anger personality. But whenever he is in a company, he is better. So indifference better when he is in a company. So a simple storic rubric that you have to remember, that is company desires for. That's a choice of a patient. Why he desires company after a lot of different permutation combination, different colors of how will the patient come and tell symptoms in front of you. For example, anxiety when alone, cheerfulness in company, fear of being alone, fear of solitude, inconsolable, indifference when in company, and talks desires to someone, weeping when alone, and then go to the repertory chart. You get lots of remedies. Then you put the thermals. Then you put the hot chili remedies. Then you see some mental symptoms. Add some symptoms which are like verbal, non-verbal communication. Add those, and you prescribe and you hit the stimulum. This is how basically you have to take the patient symptom and then interpret in rubric form. So interpretation of patient's language in rubric form is very important to understand. So my dear friends, if you like this video, do share and subscribe. Thank you.